Dr. Quinn, thank you so much for joining us.
Hey, thank you.
Well, the president received a cocktail of drugs, so let's talk about them one at a time. First up, Regimen. Tell us about this drug cocktail.
I mean, this is an amazing therapy. Typically, individuals that are elderly, such as the president at 74 years old, or people with chronic medical conditions, they're more vulnerable because their immune system is slightly compromised in most cases. But with the Regimen antibody cocktail, basically what happens is an individual that contracts COVID-19, if they're young and healthy, typically they'll have an immune system that can produce antibodies at a high enough rate and speed to attack the COVID-19 and fight it off, and they have a better chance of recovering. But for those individuals that are vulnerable, by receiving the Regimen antibody cocktail, they receive the antibodies, and if their immune system might not be strong enough to produce these antibodies very fast at a high enough level, they're getting antibodies that are derived from someone that had COVID-19 and beat it with the same antibodies. Now they have the same fighting chance, and our president is doing better after receiving this Regimen antibody cocktail.
And another part of the treatment was the steroids. Talk about what steroids do to your body.
Right. We've been using steroids for many years, and they've shown a great deal of effectiveness at decreasing the inflammation. And one of the #1 reasons people lose their lives from getting COVID-19 is inflammation in the lungs. And as we can remember, our president, he was having low oxygen saturations, meaning he could have possibly been getting some of this inflammation in the lungs. But getting that dexamethasone early, that steroid, it helps to fight off this inflammation, and it helps a person not develop this inflammation in the lungs, and he's doing better. So this treatment was wonderful. And lastly, the remdesivir, it's very effective as well. He received this as a third part of the treatment. It works inside the cells. So if COVID-19 gets in the cells, it decreases the virus's ability to replicate, helping a person recover. So this was an excellent choice of medications. A lot of people were a little skeptical, but I think that this will increase the confidence in America that these scientists, the FDA, they're doing the necessary testing. The medicine is safe and it's effective.
So Eli Lilly just announced it's seeking emergency authorization of a drug and antibody combination. So you'd be in favor of this, I would imagine.
Oh, most definitely, because, I mean, these antibodies, the people are receiving the antibodies. I hope they get the emergency use authorization because it helps the people that need it the most, the vulnerable population, so that we can win this war against COVID-19.
And with the president, I mean, we've been talking about him in this interview. He continues to report improvement. Do you think that offers hope that the treatments can make a difference? And what would you say is the prospect for mass producing these drug cocktails?
Oh, most definitely. As I said before, the president has the most important job in our country. And by the doctors using this medication that a lot of people are questioning, it shows confidence that this medicine can be trusted, because they would not just give the medicine to the president of the United States if it wasn't safe. The president received the medicine. The president is doing better. I think this is going to boost confidence. And these companies, they're already mass producing the medicine. They're ready to put this medicine out. And I'm telling you, things are going to get better. This is a very good day for America and a very good day for the world.
Well, thank you so much, Dr. Quinn, for your perspective. And I'm sure we'll have you on again. And thank you again. We're back after this.